Section of the Ehlers-Danlos Syndrome Nursing Education Series, we will be discussing an overview of the nursing care for the patient with EDS. In preparation for this educational series, we did, as I said, a survey asking sufferers of diagnosed and probable EDS what they would like nurses to know when caring for them. We wanted to educate you not only on the disease itself, but on what the patients wanted the nurses to know. By far, the prevalent theme throughout the survey was that patients wanted healthcare workers to listen to them. Not only was this a specific answer to an open-ended question, but it continued to appear as an underlying theme in most of the answers in the subtopics like pain, GI problems, or mobility issues. As nurses, we are trained to get both subjective and objective information when formulating a plan of care. Now, with experience, this information gathering becomes automatic, and it occurs while you are multitasking. So you're carrying on a conversation, possibly walking a patient to the restroom, and while doing this, you may even be thinking about other tasks that you have to perform. Because of the pace that most nurses work at, we can witness information but not actually process it, or we can process it for the moment, but perhaps to pass it on later. And what seems a simple part of someone's care to us may be enormously important for the patient. So first and foremost, the basis of all care is to provide safety and dignity, never ever underestimating the latter. Every nurse knows that sometimes in your report or handover, you don't just get simple patients. You may not. You may have a patient that doesn't have just one diagnosis, but several. You have a patient that doesn't have just one diagnosis, but several. And when you have a patient with EDS, they may have EDS as a primary diagnosis, but many secondary diagnoses and subcategories of symptoms because of those secondary diagnoses. For example, they may have a severely damaged shoulder with a diagnosed problem, but it will be secondary to dislocations, which are secondary to the EDS. So EDS can affect multiple parts of the body in different ways and at different levels. So for each EDS patient, you will need to pull from your underlying knowledge that you have about connective tissue and be aware of symptoms, limitations, and complications that are occurring with your patient, and then adjust your care accordingly. One symptom that is experienced by over 90% of EDS patients is pain. Now, this pain can be hard to describe, and at times they may describe it in a way that is unfamiliar to you. So what you need to know is that dislocations and muscle spasms and unstable joints on a whole are unpleasant. Listen to your patients. Learn their pain scale. They will most likely have a very high pain threshold, so if they say it hurts, I assure you it does. With severe cases of hypermobility, people can dislocate fingers by simply pulling up their blanket at night. Us older EDS patients have painful joints that are now limited in movement, but that's due to damage from hypermobility and early arthritic changes. Any pain or the fear of injury affects mood, sleep, appetite, and general psychological well-being because it wears people down. Patients need to be able to say when they're in pain and know that you will try to help them get some relief. This does not always mean medication, but sometimes it does. It may be help with mobility, with positioning, advocating to the doctor to order some PT or physio. Most patients will benefit from regular gentle exercise, but this may only mean a very slow walk or isometric exercises depending on their level of disability. If you have heard about a patient's pain for several days, please don't become immune to it. I can say from experience that prolonged pain is physically exhausting. If you heard the complaints repeatedly, imagine how sick of that pain the patient is. They may be irritable, fatigued, forgetful from broken sleep. There is a Facebook post showing an ultrasound photo of a fetus, and it says, "This is the last time I got a good night's sleep," which I think is very appropriate for many EDS patients. Pain levels vary, very appropriate for many EDS patients. Pain levels vary, so just because someone can appear okay for a period of time during the day, it doesn't mean that when their pain occurs, it isn't real. Acknowledge pain and ask the patient what makes it better, what makes it worse. If a person relates having any procedure or hospitalization with severe pain, their anxiety level will be up the minute they walk through that hospital door. If your patient has dysautonomia or POTS, the first things you need to think about are safety, comfort, and dignity. Use slow movements and continuously evaluate their mobility. Anyone who falls or faints is at serious risk of injury, as are you. Also remember that it is very embarrassing to most people. Patients who are dealing with this may know what works for them, so you need to listen to them. Also, you may give them some nursing measures for transferring easily and preventing injury. So you need to work with what they know and with what you know. They need to keep hydrated. You may hear them say that salty foods or electrolyte drinks may make them feel better. You may see fluctuations in pulse, blood pressure, temperature that are not normal. So with these patients, you must be extra cautious not to dismiss symptoms of complications as part of their EDS and their dysautonomia. Considering GI problems, these problems can go either way, from irritable bowel syndrome to gastroparesis. Nursing measures require symptom control and evaluation of nutritional status and hemodynamics. One type of EDS in particular causes severe periodontal issues, so please be aware of their nutrition. Be aware of blood results. Are they anemic, dehydrated, even ferritin levels, diarrhea with antibiotics, etc. I ended up once having iron infusions after a bout of GI problems after surgery. And of course, there's always the psychological aspects of GI symptoms when combined with mobility issues. This is where your basic nursing comes in. Make sure that you're available to help the person get to the toilet or with any toileting issues, that there are tissues nearby, sick bowls, water, call bells, that curtains can be pulled, all within reach. I personally once woke up after a first day post-op extremely nauseated, couldn't eat, taking morphine, which makes you more nauseated. And my poor nurse was aware, but she was running her legs off, as they do, and finally needed to be sick, no sick bowl. So my very stoic British roommates didn't blink an eye. They called the nurse, asked me if I was okay. Luckily, I managed to grab a plastic bag that was on the tray for disposal of tissues, and that sort of saved a bit of my humiliation. But needless to say, I was mortified because some of them were having the first meal they'd had in days, and I was being sick. I was being sick. So please be aware of your GI symptoms of your patients and the GI problems, and prepare accordingly. Most GI problems are quite embarrassing. Much like GI symptoms, urinary problems require preparation and treatment of symptoms. Frequency and urgency become huge problems when your mobility is affected. Think of safety and dignity. Patients may have skin issues. Healing may be delayed. Sutures may not hold as well. Some have excess bruising and bleeding. They may have allergic reactions or odd adverse effects to medicines. Allergies may also be to tape, staples, latex, etc. Please be observant. Other system issues include endocrine issues, GYN issues, and hemodynamics. If the patient has vascular EDS, this is highly specific to complications such as bleeding and organ rupture. Remember that this is a person trying to live their lives. These symptoms can cause a great deal of anxiety. I've heard many sufferers say that they have started and had to stop jobs, school courses, projects, holidays, etc. This can have a great impact on relationships and intimacy as well. Musculoskeletal issues are something we've touched on before. but just to make sure that you are advocating for your patient regarding joint pain and instability and the need for physiotherapy and devices to help them mobilize. Please be aware that your patient may have an overreactive allergic system, an underactive immune system, depending on their general condition. They may have poor nutrition. They will be at risk for poor healing, depending on their skin and, again, their general condition. There's also often a psychological aspect of EDS where there's a great relief when you're first diagnosed because all the symptoms finally have a reason, but this is often followed by a daunting realization that this will affect you for the rest of your life. Some patients who have had very serious episodes, serious side effects, or bad experiences may have a PTSD-like reaction and are at great risk for depression. Again, to quote Professor Rodney Graham, because it is such an important quote, no other condition in the history of modern medicine has been neglected in such a way as Ehlers-Danlos syndrome. The patient will need reassurance that effective management of EDS is entirely possible and will enable them to lead happy, productive lives. Just a quick quote from Rebecca Holmes, Ehlers-Danlos Support UK, Edinburgh area coordinator. She highlights the fact that one of the hardest parts of her job is trying to explain over and over that the services are limited. And this impacts the patient because they must self-advocate. So one of your jobs as a nurse is to help this patient learn to advocate for themselves, but also to advocate for them while they are in your care. To summarize, always listen to the patient, hear what they have to say, prioritize their pain management, validate their pain, don't underestimate it, and realize their pain thresholds. When caring for these patients, you must go in with a multi-system and multi-symptom care management plan. Be aware of the impact that this is having on their lives. Support the patient. Ask the doctor to make referrals. Advocate for the patient so that they are directed appropriately within the healthcare system. Thank you.